Welcome everyone to another exciting session on diversity, equity and inclusion. We're lucky that all of our presenters are here, and the floor is for Christiana. Please welcome her.
Hi everyone, thanks for coming, especially on Friday afternoon. So my name is Christy, and today I'll be presenting on the understanding the unmet sanitation needs of underserved populations in the US. And I currently work at CDC, but this work is on behalf of the organization Wish for Wash, which is an organization based out of Atlanta. So to start off, many of us should be familiar with Sustainable Development Goal 6.2, but I'd like to reiterate why it's important in the context of high-income countries. SDG 6.2 aims to achieve adequate and equitable sanitation for all, with special attention to the needs of women and girls and those in vulnerable situations. Throughout this presentation, we will focus on vulnerable populations in the US and factors that influence their access to functional sanitation. So our three populations of interest we focused on are Americans living in rural areas, American Indian and Alaska Natives, and people experiencing homelessness in urban areas. So in rural America, there is generally less access to centralized wastewater infrastructure, meaning more reliance on on-site sanitation systems, leading to more responsibility on the individual rather than the community. American Indian and Alaska Native populations living on reservations are also often limited by funding that they receive from the US government. American Indian and Alaska Native homes are also more likely to lack complete plumbing as compared to the general US population. Lastly, more people are experiencing homelessness as the cost of housing increases without any plans for affordable or temporary housing options. And people experiencing homelessness are often more at risk for exposure to pathogens. So during our background research, we also found that nationwide data measuring access to sanitation is incomplete. The American Housing Survey, which is used by the Joint Monitoring Program to measure sanitation access in the US, does not include people experiencing homelessness and therefore is overestimating access to sanitation in the US. In addition, the 2013 American Community Survey reported that 0.5% of Americans do not have access to complete plumbing, which is defined as having access to a toilet, shower, and running water. This question has its limitations as it doesn't clearly specify which of the three is missing. It also doesn't specify whether the toilet is working or where the waste is going, which are important questions for determining adequate sanitation. On top of this, complete plumbing question was entirely removed from the ACS survey in 2016, so no new data on this is being collected. So this leads us to a research question which states, what are the social, economic, and environmental factors underlying the unmet sanitation needs of people living in rural areas, Native American territories, and urban areas with high rates of homelessness? And unmet in this context is relative to the SDG targets. Our methods, we conducted a systematic review of literature published between 2015 and 2020, which is when the COVID-19 pandemic began. We included key terms for populations of interest describing sanitation in the US, and we originally identified 761 articles, but only included 26 in our final review. So moving on to results, I'll start with socio-demographic themes that we pulled out from the literature. So in rural communities, we identified themes of structural racism and redlining, which both result in minority populations living in less desirable areas and with less prioritization for development. In addition, maintaining sanitation systems, specifically septic tanks, puts a large financial burden on the individual, where the median household income is $22,000 and a septic tank costs $15,000. And unfortunately, in a lot of places, failure to maintain your septic system is a criminal offense. In American Indian and Alaska Native communities, income in combination with lack of investment from the US government was an important theme related to access to functional sanitation. Among people experiencing homelessness, we found that experiences of women and people who menstruate are particularly important and revolve around feelings of safety, privacy, and cleanliness of public toilets. People with physical or mental disabilities may be unable to use these toilets even when they're available. And lastly, in California, homelessness was made a criminal offense in order to reduce the burden of disease, but this wasn't accompanied by any affordable housing or toilet campaigns. So moving on to the effects of climate on these populations, we found that in general, all three populations were affected similarly, so we combined them into one. So severe flooding, erosion, melting of permafrost threaten the integrity of infrastructure across all communities, but the lack of resources and vulnerability of these three populations puts them at higher risk. Soil type is particularly important in rural areas where septic tanks are commonly used. Clay soil expansion reduces the ability of discharge from septic tanks, which could lead to environmental contamination. And then tying back to socio-demographic impacts, redlining, specifically in Alabama, has forced minority populations into less desirable areas with this clay soil, and therefore malfunctioning septic systems. Moving on to centralized sanitation alternatives that were mentioned in the literature, we combined American Indian and Alaska Natives with rural, since a lot of these these alternatives overlap. So the first is septic tanks, which I mentioned several times are expensive to maintain. The second is dry sanitation systems, which are very useful in water scarce areas. Outhouses are a good option, but they raise the risk of falls, especially in colder weather. Straight pipes are pumps that dump directly from the home and can contribute to environmental contamination. And lastly, there was some literature on a population in Alaska where they were using plastic bags to collect their waste and leading to a lot more human interaction with waste directly, which raises the risk of exposure. Some of these sanitation systems, like septic tanks and improved pit latrines, are considered improved sanitation, but they do require extra help or maintenance to remain functional, and therefore equitable when compared to centralized sanitation. So moving on to people experiencing homelessness, the main alternative is open defecation, and we found that there were a couple of reasons why people perform open defecation, and this was because of closures of shelters, poor shelter maintenance, the need for purchasing something, the general lack of public toilets, and then also the perceived safety. Specifically, some women find it safer to perform open defecation rather than experiencing some sort of harassment in a public toilet or dirtiness of a public toilet. The last results section is on health outcomes, and I will start with rural populations where there was really just one main article that we found. So this paper discussed intestinal parasites in Lowndes County, Alabama, and you may have heard this community mentioned several times today. So this is an area with soil that is not suitable for septic tank functionality, resulting in 50% of homes having a failing sewage system or no sewage system. The majority of homes reported using straight pipes, which pump sewage no more than 10 meters outside the household. And then when flooding occurs, more than 42 participants of the study reported seeing sewage inside their home. There's also 35% of stool samples from this population tested positive for Foodborne, which can be transmitted through soil or water. So this case study was very detailed and informative, but it's the only one that we found in our literature. So it's unlikely that this is the only population like this, but there's a lack of data covering anything else up. So moving on to American Indian and Alaska Native populations, we found very limited data reporting primary health outcomes related to sanitation. We found some secondary reviews of other studies reporting improvements in health outcomes with improved plumbing, but nothing with sanitation. We also found some indications that COVID-19 was higher among American Indian and Alaska Native populations, but no health outcomes were directly related to sanitation. We did come across anecdotal evidence that people who have to travel outside the home to use the toilet are more likely to fall, as I mentioned before. Among homeless populations, we did not find any papers providing infection rates among homeless populations related to sanitation, but several papers indicated that bacterial and GI infection is common. They just didn't present any results or findings related to this. We identified one gray literature article that discussed hepatitis outbreak in California that resulted in a mass vaccination campaign and spraying of streets, but they didn't present any changes in infection rates after doing this. And lastly, in our review, we found qualitative evidence that identified shame, anxiety, and urinary tract infections as health issues experienced by people who menstruate, but who did not have adequate supplies, but that was just one study that we found reporting this. Okay, so going back to our research question, our search uncovered underlying themes of systematic exclusion and centralized sanitation, either through redlining or forced settlement, criminalization, or general lack of investment in infrastructure. We also found that the rural American Indian and Alaskan Native and homeless populations may be more vulnerable in the event of an extreme climate event, and that health outcome data related to sanitation is not thoroughly collected among these populations. In more recent news, okay, I think I'm over time, but there was this expensive sanitation system that was placed in San Francisco, and it was just one, and it's not clear if there will really be a health impact. So more research is needed on that, and also how can we reduce the price of these sanitation systems. And then in order to reach SDG 6.2 by 2030, we need to improve research and reporting of sanitation access in the US, and we need increased investment, especially among vulnerable populations. And lastly, we need to continue to advocate for affordable housing. So how might you take action in addressing the underlying systematic exclusion of vulnerable populations in the US? Thank you.
Thank you so much, Christiane. That's such important work. I mean, I wouldn't ever think US when I think of hookworm, so this was quite shocking. We have time for a couple of questions.
Christy, when you were looking at populations experiencing homelessness, as a resident of Southern California, I also think about, for example, all the RVs lined up under the overpass and things like that. Do you know if they were included in this? Because you know, they're not unsheltered people, but they are lacking in means to empty sanitation. A lot of those things are non-functional. They don't ever move. And you know, I do remember like one article coming out, a local paper one time, about the thousands and thousands of gallons of untreated sewage coming from these basically interstate side trailer parks of not abandoned, but lived in non-functional RVs.
Yeah, so I remember, I think, probably reading the same paper when we started this, and we decided not to include that in our literature review just because this was already a lot of information, but that's definitely an important community to think of as well. Also, we chose not to include any of the territories, so Puerto Rico, Guam, just because they might reflect more of a lower income community, and we also just didn't find any initial research when we were preparing for this, so.
Hi, thanks. A lot of the results that you showed about rural populations were focused on some of the structural racism. I was wondering if you had found any papers on some of the actually predominantly white communities up and around like Appalachia, where like coal towns had moved out when like, you know, mines had shuttered and stuff like that, or if that just didn't really come up enough to make it into your central themes that you presented here.
Yeah, so that's something that I've seen a lot after we finished or did this search, and I think maybe it was something, the words that we used in our search, that those communities didn't come up. We really expected them to come up using rural search terms, but since we didn't specifically search for Appalachia, that's probably why they didn't come up. But yeah, I've heard a lot of information about those communities as well. And I think also something that was not represented in this is some of the more suburban communities that are not connected to centralized sanitation, but they do have sanitation, but there's some issues there, especially with redlining. There's a paper that I read that specifically showed that one street was connected to centralized sanitation and the next street over was not, and the street that was not connected was a minority population. So there is still even more information that I haven't provided here. And also we looked at papers from 2015 to 2020, and I think a lot has come out since then as well.
All right, thank you so much, Christy. Well, morning and kindly join me in welcoming Leticia from DigDeep and Stephen from McManus.
We're still there.
Okay, yeah.
Great, thank you for coming to our session. My name is Leticia Marques, and I'm a data coordinator with DigDeep, and this is my colleague, Dr. Stephen Gasteyer with the Department of Sociology at Michigan State University. Today, we're going to be discussing our efforts to address the water access gap in the United States. So most people would presume that people living in the US have universal access to potable water and sanitation. However, this isn't the case. In 2019, DigDeep released the Closing the Water Access Gap report, which found that over 2.2 million people don't have access to basic plumbing. This includes running water and sanitation. And then when you take a look at the Joint Monitoring Program, the JMP, they estimate that 3% of the US lacks access to water and sanitation, putting this number at over 10 million people without basic plumbing. And then when you account for the Safe Drinking Water Act and Clean Water Act, that number is estimated to be over 40 million people. So these different numbers show that there's a clear lack of understanding of what the wash space in the US actually looks like, but it's clear that the problem is there. And those who are disproportionately affected are typically communities of color and low-income families. One of these impacted communities includes Cochrane in the colonias of El Paso, Texas, where DigDeep has worked to bring running water to the families there. And we have a quick clip on.
We've been waiting for water for 25, 26 years. I told my mom and my dad, I'm not leaving here, I'm not getting married until we bring water.
Él es el único bebé y sin casarse, es el que nos está ayudando aquí con el agua para todos los días.
Y mal porque pues qué tanto es la distancia para que hace muchos años hubieran resuelto este problema que tenemos. Estaba chiquito, pero sí se acuerda, ¿verdad? Que anduvimos hasta haciendo marchas. Su papá y su mamá andaban, ¿no le platican? Íbamos con su mamá allá a la corte, el domingo peleando el agua. Y lo que nosotros no logramos, lo logró él.
The funding provided to the Cochrane Colonia.
Judge Samanero. Motion carries.
Que para cuando él ya se llegue a ir de aquí, se casa y ya se quedan con su agua, ya se quedan, que no anden batallando.
I didn't want to leave from here until there was water running. And I've always said it wasn't even for me, it was mainly for my parents, for all the people here. It's all for me, and this is all family, this community is all family to me. Ándale, pues, muchas gracias.
So communities like Jack's remain invisible at a national scale, and you can see these communities all across the US. And this fact is exacerbated by the lack of robust data available to us in the wash space. This poses a really big challenge to wash initiatives. Vulnerable communities continue to see inequities, and the lack of data makes it difficult to target support where it's needed. Wash inequities will remain prevalent should data systems fail to scale and visualize the issue in the US. To address the lack of data available, DigDeep is collaborating with Michigan State University to begin filling these data access gaps. We're creating a novel open access dashboard using existing WASH data to display and bring attention to the growing water access gap and the communities it impacts. We've used several federal data sources paired with narratives to showcase the effect of the water access gap.
So what we chose to do was to try to create a visual that could display the ACS data. So the U.S. Census American Community Survey data gives us the closest thing to a measure that tells us where people don't have even the most basic supply to water and sanitation. So So what we did was decide what we wanted to do was to display that data. And then we're building in as well the Clean Water Act and Safe Drinking Water Act data. The idea being that this can get us hopefully at the roughly 2 million who we know don't have access to water coming through a tap, but also start to give us a proxy indicator for those communities, and there are millions of them in the United States, where there may be water coming through the tap. The problem is when it comes through, it's not drinkable, or who have a totally non-functional functional system, like Lowndes County, Alabama, we heard about in the last presentation, where if you look at the data, it looks like they have complete plumbing and sanitation. The problem is the sanitation comes into their house or floods their yard. It's not actually a functional situation. So our idea is to combine the data that's out there, recognizing that it's not perfect, and and combine that with narratives so we can start to understand what's behind these numbers. So there's a lot of really fancy words up there. The short and the long of it is we now have the capacity to build a data set that has built into it the AI and machine learning systems that can capture the data as it is released. So we're thinking what we're going to do is update the ACS data annually, because that's when ACS updates it. We'll be updating the Safe Drinking Water Act and Clean Water Act data quarterly, because that's when it's updated, and pulling it in. So you'll be looking at as close to the existing data as exists when you look at this dashboard. So, in the interest of, I will not click on it now, but this is a live dashboard. And the idea is when you enter the dashboard, you end up with a map of the United States. That map is then tabulated down to the county level. The county level is important. It's not the unit of analysis that's closest to where people actually lack access to water, but it is the unit of analysis that will allow us to combine data sets. So you can see, you can look county by county. And should we decide what we want to do is to move into, say, El Paso County, right? So we just saw an example from El Paso County. We can zoom in. And by zooming in, what we'll see is the statistics come up on the dashboard, and we can start to see what those statistics are. This is a beta, so we have the census statistics in. We don't yet have the SWDA or the CIDWIS or the Clean Water Act information in, but we are going to be building those in. And you can then see the specifics that come up as statistics. You can say, okay, so there's 1,449 people without access to complete plumbing. This will also allow us eventually to say there are 3 systems that have been out of compliance for more than four quarters, and they have an effluent problem, just as a for instance, over time. And then you can go in and you can see the narrative in written form that will tell us about Bertha, for instance, who's another example from Cochrane, who's lived in Cochrane her whole life, and what was her story in getting us moving from not having access to clean water and sanitation to now having that luxury, so to speak. So that's basically it in a nutshell. That's what we want to build. Now I will just conclude by saying our vision is that we will start with the American Community Survey, and then Safe Drinking Water Act, then Clean Water Act. So you'll have those snapshots up there. We then want to interact with folks like you, because what we want to be doing is going out to those people who might use this information to better identify where are those communities that need assistance. And what we know is that basically, the US has these sources of information. They're not very good. They're not very accurate. We want people to be able to tell us, yes, you know, what's really interesting is you're showing that there are no Safe Drinking Water Act problems. no Clean Water Act, and they have lots of access to plumbing, and yet I know in this community people can't drink the water that's coming out of their tap. We want to know about that, because part of what we're hoping is that A, we'll identify other data sets that we need to be building in. B, we want to be able to go back to I'm going to single out Kabir back there. We want Kabir to be able to go to Washington and to say, we need more money to better collect this information, because we know of 15 communities that showed up as having no problem whatsoever using the best available government data. And that tells us that we need better available government data to be able to get to this. So with that, I can close, and we look forward to answering questions.
Thank you so much. That was some really exciting work. Yes. Well, I have a lot of questions as well, but I'm trying to be polite.
Yes, thank you guys so much. As always, great work coming out of DigDeep. A few questions. I know, like, whether or not a system is operational or there's any flow at all, that data is impossible to come by because it's not regulated. So curious as to how you might address that. And then part B is, outside of exposing the need or, how many communities need support, we've found that there's a lot of missing data when it comes to classifying communities as underserved or disadvantaged.
Yeah.
SRF means, you get a larger percent loan or grant versus loan if you're disadvantaged, but if you're in a higher census tract, that skews the data. So we're seeing that it's very hard for these underserved communities to qualify as quote unquote disadvantaged or underserved. Is there any thought being put into maybe approaching data from that angle as well?
Yeah, and that's actually an excellent question. What we know is we're going to be missing communities. Part of the whole vision of this is that we're pulling in those kinds of information. And what we also know, we're tracking right now 5 different efforts we know of where people are building dashboards for other purposes, some of which are hoping to get at that kind of stuff, right? And so we are absolutely hoping that we can use this as a platform that then has links to other kinds of dashboards that are out there. So if somebody really wants to know about where is the SRF funding going in a community, we want to be able to have that maybe as a link on this information, right? And so we can start to say, oh, this is really interesting. Not only do we have this community that's in deprivation, or not only do we have this narrative that shows that the information is totally wrong, but there hasn't been any funding in this community for the last 15 years. What's going on there? So, yeah.
So earlier in the earlier session, we saw that the EJ screen tool that EPA has now has also overlaid the water districts and sort of, so there's a little bit better ability to get to who's being served by a utility or not being served at all. So I was wondering if these two will be able to talk to each other in some way?
That is the plan over time. So to figure out whether we can actually make that a layer, right? Which is definitely something that our Matrix, which is our team at MSU, is looking at. Our challenge, quite frankly, is going to be how do we keep this? What's beautiful about this right now is it's simple, right?
Yeah.
One of the things about the EPA EJ screening tool is its strength is that there's loads of information in there. Its weakness is it's incredibly confusing to look at, right? And try to and so that's going to be our balance over time, is how do we make it, how do we, on the one hand, incorporate the information that's really important, and on the other hand, keep it simple enough? Because our dream would be that the person sitting in Raleigh, North Carolina, who's interested in doing work in a community in the state that's lacking access to water and sanitation can use this as a tool to pick out where that community is, right? And so I'm thinking of the RCAPs, I'm thinking of the Rural Water Associations, I'm thinking of all those that full mosaic of service providers that are out there whose mandate is to find these communities, can we help them to do that? And you can't make it too complex if you're going to do that, right? But at the same time, we want enough information in there that we can really, it's telling us enough that we're headed in the right direction, right?
All right, thank you so much. Yeah. Up next, we have Catherine from UNC. Please give her a round.
Let's see if I earn it first.
Of course you do.
Okay, hi everyone. I'm Catherine McManus, I'm a UNC student. I will be talking today about a couple of the bullet points that our first presenter mentioned, and I'll try not to be too redundant to what we have already seen in the last half an hour. But I will be talking about infrastructure service provision in tribal communities in the US. So before I get too deep into it, I do want to do a very brief land acknowledgement. Aaron talked about this on Monday, which I think, as we all know, was Indigenous Peoples' Day in this country. But the United States is colonized land, including where we are right now. The land has been home to many communities who were often very violently displaced from their homes, which has contributed to, and in many ways, what I'm going to talk about today. So very briefly, I will talk about how infrastructure is officially built on tribal lands and what we can learn about that implementation process from official records, but also from archival sources. So I never expected when I began my PhD that it would involve going to national archives, but it did. And so I'll talk very briefly about some examples of what I learned from those trips. So this is probably the most redundant slide, but we talk a lot about access to infrastructure, and as we just learned, it's a flawed indicator. The only indicator that is really available to us is very flawed. So I will not read all of this, but I'm thrilled to hear that a solution is forthcoming and in the works. But essentially, my conclusion here is that we're not asking the right question of necessarily the right people. So as I mentioned, of course, and as we all know, the United States was colonized, and the U.S. then signed treaties with federally recognized, at least, tribes. And I'm not a legal scholar, I'm just an engineer, but essentially what that means is that the federal government kind of said, in exchange for what we have done to you, we will be a trustee of your future, providing services, providing quality of life. And so those activities, in theory, are carried out by federal agencies. And it's a mess, in terms of who does what and who's responsible for what, but the two primary implementing agencies are the Indian Health Service and the Bureau of Indian Affairs. And when we're talking about WASH infrastructure, we are talking about the Indian Health Service's Division of Sanitation Facilities Construction. And so before I go to any other slides, I want to say that when IHS says sanitation, they do not use it in the same way that we in this room this week use sanitation. It's much more of a catch-all term that does include water and solid waste management as well. So future, subsequent references to sanitation are not just wastewater in the way that some of us might be used to. But they use a system called the Sanitation Deficiency System. And this on the right is a screenshot with my highlights of from that policy, from the Sanitation Deficiency System's approach to designing infrastructure. And what they do is they categorize need according to deficiency levels. And those levels range from 1 to 4. You get a 4 if you have no infrastructure at all. You get a 5 if you have no water or wastewater infrastructure. And projects must be designed, they will only be funded if they address an existing deficiency based on the level of inadequacy of whatever exists or quite often does not exist. And we can talk in detail later if anyone wants, but there are design criteria and cutoffs for what is considered a deficiency. Recent and current through 2023, we're still, of course, living 2024. Deficiency levels are presented here. So on the 2023 list, and we can talk a little bit about prioritization of that list, but essentially what happens is every tribe, every community who is eligible for funding prepares their prioritized list, and they submit it up, and it kind of funnels up to the government and then gets reshuffled according to areas. They're geographic regional areas that receive allocations, and they spend money moving down the list until they're out of money. And as we heard, and as I will show, they run out of money pretty quickly. And what that means is that, yes, the average deficiency level is going down, but the total amount of money that the list asks for every year is going up. So in 2023, the 1,400 or so projects that were on the list were estimated to cost almost $5 billion US. But in 2021, when the program got an improved allocation from Congress, which was a huge jump, they only got $700 million per year. And so what that means is that projects are languishing on the list. In 2023, 32% of the projects had been on the list for at least 5 years. And certainly more had been added, more recently. Also, interestingly, there is a designation for infeasible projects. So the program has a way that they categorize which projects are feasible and infeasible based on a number of factors, including perceived cost effectiveness. And when we think about, maybe geographically or climatologically where a lot of these communities are located, not necessarily by their historic choice, that certainly contributes to the perceived, I'll say, feasibility or infeasibility. Which means that I only expect the total cost ask to keep growing. Okay, so now that I have established that the program doesn't have enough money, let's talk about what they don't have enough money to actually do. Projects funded under this system are for capital construction where there is existing domestic demand. So that means that they will serve a house that exists today, where people live today. If you want to design your system to encourage or even just plan for future population growth or certainly economic growth, too bad. And so what that means from an engineering perspective, I'll say, I look back to when I was being trained as an engineer. You plan for decades in the future. You size your pipes, you size your tanks to plan for growth. That is not happening under this system. So future development anticipated needs, so that includes aging infrastructure. If we're talking about replacing aging infrastructure, that's not necessarily a deficiency. And the requirements for saying like, well, this pipe breaks regularly because maybe it was undersized or used an inadequate material isn't good enough. There are high requirements for documenting those problems to prove that they are deficiencies. And as I mentioned, it's only domestic service. So if you want to start a commercial enterprise, and it's the building code or insurance requirements require a fire suppression system, you have to seek that money elsewhere. So I don't see the sprinklers, but I'm sure that they're here in this room. That's not covered. You have to go somewhere else. And that is in contrast to what I saw from design documents and correspondence about historic design of infrastructure on tribal lands from decades past. So, there is talk about, well, let's size the pipe to make sure that the community can grow, and let's plan for sprinklers and for fire suppression. So we have regressed in terms of the policy, in terms of planning for future growth and for fire protection. Something else that I want to note is about the quantity of water that is considered sufficient or insufficient to be considered a deficiency. And so this is a direct quote from the policy, that 5 gallons or approximately 20 liters per person per day is considered having access to water according to this policy. And so if you're providing that, you do not have a deficiency. And I want to highlight that, well, where we are, for those who don't know, is Orange County, North Carolina, where people use an average of 70 gallons. So way more liters per person per day. So if we're remembering, okay, the trust responsibility of the U.S. government in those treaties was full benefits as American, even if not voluntarily, American citizens. That is not what's happening. And I do want to say that when systems are designed, if none existed before, they don't stop at 5 gallons per person per day, but it's really about the prioritization and what is considered need and what is considered inadequate. So generally the takeaway is that despite the U.S. government's responsibility to the tribes, they and the U.S. citizens are not fulfilling our responsibility to these communities. And I think, the point that the first speaker made about resources is absolutely it. They have a lot of, if I can reflect, a lot of the issues that we've heard every other day this week. Not enough workforce, not enough money, certainly not enough emphasis on operations and maintenance. It's only capital and often inadequate or low quality capital. So people are trying and even advocating at the highest levels of government, but the design standards really limit what those people can do with whatever amount of money that they have. So that was very quick and I went over time, so thank you to my timekeeper, but
Thank you so much, Catherine. I am so riled up after that presentation, but any questions, please?
So I am curious, how does IHS funding relate to some of these big ticket? So a few years ago, I did a study that included a description of the mini Wachoni project on the Lakota Nation, which was like hundreds of millions of dollars, right? It's a big pipeline project. Theoretically comes through IHS in some way, but I don't understand how that relates to what you just presented.
Yeah, I'm not sure that anyone does understand. But I said IHS and I said BIA, Bureau of Indian Affairs, and they are two players, but the Bureau of Reclamation is involved, certainly EPA. I don't know that specific project, so this is pure speculation happening up here, but I would bet that those two are involved, in some way. Maybe someone knows? Oh, no, okay, different question. But it's a whole patchwork, which I think is another, and I didn't mention it, and certainly didn't touch on it, but another challenge for tribal leadership, navigating these funding sources and complying with the requirements. Projects only make it onto the list if you have a certain level of schematic design and you have a cost estimate, and all of that costs money, and not every small tribe is going to have an engineering department that is able to just constantly be coming up with ideas that maybe will be getting funding. They're dealing with pipe breaks on a weekly basis. So to your point, I can't answer it, but it's a really complicated, maybe unanswerable, mess for everyone.
I'll make this quick. Great research, great presentation. Really wonderful to see the Indigenous nations highlighted today. And Molly Sullivan with AWWA and Community Engineering Corps. But real quick question, we're just starting to get some exposure in the Indigenous nations, and first, observation is that there's a lot going on. There's not much master planning or deconflicting projects. There might be a pipeline coming in 2 miles down the road, yet you're not aware of that. So is that your experience in general in the Indigenous nations, or do you feel like there is like master planning, kind of comprehensive planning going on?
I would tend to agree with you. I certainly don't want to be like, yes, absolutely everywhere. My sense is that it's a triage situation in a lot of ways, you know? Like, okay, yeah, if there's a pipe burst and I need to track where that water is coming from, especially if I'm in a water scarce situation, you know, where it's super expensive in financial, but then also just water resource perspective. I think something that's key that I didn't mention, that is a huge negligence in my opinion on the part of the Indian Health Service in this system, is that a lot of times their budgets run out before they make as-builts, which means that they are handing over these complicated infrastructure systems and saying, okay, you know, Tribe X, you are now responsible for this infrastructure, for maintaining it. You know, we're certainly not going to help you in any way to do so. But we're not going to tell you where we put any pipes. You know, and we're talking about systems that are 50, 60 years old, and so even if I was there when it was installed, I might not be there when it eventually breaks. And so I think, you know, to your point, there's the master planning, which in my opinion needs to involve a major investigation of like what exists today, you know, some kind of inventory.
Thank you so much. That's really good. Up next, we have April from Georgia State University. Please give her a round of applause.
I know you're applauding for me and also because I'm walking around on crutches. So proud. Okay. The moment we've all been waiting for, the last presentation of the conference. We're switching gears a little bit, still obviously focused on the US, but I'll be talking about menstrual hygiene, menstrual health and hygiene policies in the US, specifically related to K through 12 schools. And so just so we're all on the same page here, giving a brief bit of background. So globally, we know that adolescents face many barriers to safe, hygienic, and dignified menstruation in school settings. And research shows that key challenges include inadequate access to menstrual materials, a lack of supportive and private bathrooms, and insufficient education. And these barriers have all been shown not only to impact health and well-being of menstruating students, but also educational outcomes and long-term outcomes such as economic potential. Now, given that adolescence is a very critical period for developing health capabilities, ensuring that these needs are met at the onset of menstruation as well as throughout puberty is really vital for breaking cycles of inequity. And we've seen in the last couple of decades that policy initiatives have really emerged as a common strategy to begin addressing these barriers that adolescents are facing to managing menstruation, as well as to improve the MHH of adolescents. And the expansion of policies has been particularly significant in the United States, primarily consisting of state-level legislation that is trying to increase adolescents' access to menstrual materials, specifically in K through 12 schools. And there's been some research that's actually shown that between 2017 and 2022, there were 21 states and territories that had already passed policies focused on the provision of materials in schools. But amidst this rapid expansion, we've not seen any sort of systematic evaluation of effectiveness or implementation, and we've had trouble keeping up with rigorously kind of tracking and characterizing those policies. So this study aims to kind of address those critical gaps by specifically using the global MHH monitoring group's recommended MHH domains to review and characterize existing US policies that are specifically related to menstrual materials in K through 12 schools. And this is in hopes of being able to establish a benchmark that we can begin to track progress and then also generate evidence so that we can start having conversations on how we create more comprehensive policies and evidence-based policies. So to actually conduct this research, we used a mixed deductive and inductive approach. First, identifying critical components of effective and adequate MHH. Specifically, as I mentioned, based on these recommended MHH domains that were just created last year, and they're pictured here, depicted here on the screen. Now, these reflect thematic synthesis of definitions of menstrual hygiene management, MHH, and menstrual health. So they're quite comprehensive. And from there, we also conducted close readings of policies to identify any other sort of themes or domains that weren't included in these original indicators. And then to synthesize our findings, we just generated descriptive statistics about the contents organized by those domains to then be able to characterize if and how policies are actually addressing essential requirements for MHH. And I'll just note that in the case of this policy indicator right here, there are a couple of different indicators in this domain. One of them is just the existence of policies. Obviously, that's the whole point of this review. And so in this case, policy is focused on the indicator that's related to funding to actually implement that policy. So when I'm talking about that policy domain here, we're talking about funding. So documents that were included in our analyses were restricted to the official state policy documents themselves. So anything that was outlining that enacted legislation and any official state fiscal note that accompanied it, whether it was a budget or just a fiscal analysis. We found 3 different types of policies, and I know a lot of us are starting to work with policy or maybe aren't super familiar with the terms. And so I put the 3 different types of policies that we found, some definitions just to help us in our conversation. So appropriations is really just earmarking or allocating funding to be spent on something. Authorizations is just saying you can spend money on something. And then a mandate here is where there's some sort of compliance and requirement that needs to happen. And mandates can be unfunded or funded. So what did we find? As of August 12th, 2024, 31 of the 50 US states have passed policies. Now that's since 2017, so quite a rapid expansion. Again, these are all trying to increase the accessibility of menstrual materials in schools. And depicted here on the screen. We also found that 11 additional states had actually unsuccessfully attempted to pass similar policies, and 3 had bills in discussion. So this means that from 2017 till now, actually 45 of the 50 US states had actively engaged in menstrual health and hygiene related policy, which is exciting and promising. Now, most of these policies that are on here are state mandates, 21 of them of the 31, and those are depicted in the white as well as the blue and white pattern, depicting the blue and white is mandates with funding, white is without. We also saw that 6 states had passed appropriations legislation, which is shown in the solid dark blue, and then 4 had passed unfunded authorizations, in the light blue there in the southeast. Now, the level of detail and outlining of policy actions to actually undertake was generally pretty minimal in the actual documents. So it rarely included things like a detailed budget, any sort of implementation plan, timeframes, or devolvement of responsibility. And policies on average only covered 2 of the 7 MHH domains. And no policy actually covered more than 5. So no policy covered all 7. The type of menstrual materials, approaches for making materials available to students, as well as target schools and students were the main aspects of implementation that were elaborated on in policies. That makes sense. Our search was about policies with menstrual material, right? But we actually see that only 2 policies referred to specific bathroom features and the availability of water and soap, even though the availability of menstrual materials in bathrooms was actually the primary implementation action mentioned in these policies. And so what was discussed about WASH really related to the number of bathrooms where materials should be made available, and then the gender or sex of whom the bathrooms are intended to serve. So a lot of policies had details about that. You can also see here that knowledge, discomforts and disorders, as well as supportive social environment aspects are not that commonly discussed in these policies. Additionally, no policy actually included strategies to assess the impact that menstruation had on students' day or class participation. However, 4 did vaguely outline monitoring and evaluation strategies. And then last, over half of policies did include funding, and most of those were actually recurring. Now, looking a little deeper at the most commonly included domains also reveals some potential limitations to current policy approaches, specifically related to age and funding. Now, first, very few policies actually pertained to all ages. And then second, policies that allocated and budgeted for implementation only included funds specific for menstrual materials and period product dispensers. So there wasn't discussion or mention of disposal bins, wash facilities, or any other sort of need. So what can we conclude from all of this? Overall, right, we find that current policies may fall short in effectively supporting adolescent MHH in schools. And while our search was focused on policies specific to the provision of menstrual materials in K through 12 schools, I'll just note that policies pertaining to other aspects of MHH in the US are extremely rare. And although we do have separate sex education, reproductive education policies in the US, they very rarely mention MHH and require MHH. There have been some reviews of that, and so it's outside of the scope of this, but those are showing that it's not in this policy and it's not in the other policies either. So based on these findings, just offering kind of 4 critical considerations that we can think about as we move forward. First, of course, it's pretty obvious, right? To increase the likelihood that we actually comprehensively meet adolescent needs, we need to start to try to address all 7 of those MHH domains. Second, to ensure that we're actually having evidence-based practices be implemented, we really need to have policies that have clear action and implementation plans. Current policies are quite vague, and I think we're getting better at talking about this no-do gap in integrating implementation science into our work, and I think policy is still an area that we really need to push that more. Third, to ensure that policies are meeting the needs of all adolescents, we really need to think about making our policies responsive to the decreasing average age in the US especially of the onset of menstruation. So there was actually a recent study that found that the average age in the US has decreased to about 11 years old, and there's an increasing proportion of adolescents who are starting their periods at 9 and even earlier. We're particularly seeing this among low-income and adolescents of color, and so there's of course other inequities, meaning that we really need to be thinking about this in our policies. And then last, policies should include funding. There are a lot of mandates that require schools to implement programs. There's no funding for them to actually implement those programs. It often has to come out of nursing budgets, which are already very limited. And so a lot of the times, especially in the state of Georgia where I live, nurses before our program were buying period products for kids out of their own pockets. And so this is a major issue. And in cases of where policies exist, we're also seeing that the processes to actually get money or how funding is actually allocated is not considering equity in schools that maybe need to be prioritized. And so this is a major issue in just thinking about how we actually prioritize those schools that need this funding the most. And so with that, I will stop, and I look forward to your all's questions and want to give a shout out to my collaborators for helping with this project.
Thank you. We have time for questions. Well, I think everybody is just waiting for the policymakers to come up with better policies and funding. Well, with that, yeah.
Thanks for this research. I'm Kim Lemmy with DigDeep, And a question is, we hear about school board meetings a lot in the news and we hear about, do school boards sometimes try to override some of these policies that are set at the state level because they don't disagree with them, or is there some way of like enforcing a state level rule?
Yeah, so that's what the mandates are essentially. And so in a state where there's a mandate, that is definitely the case. In other states, especially in the presence of vague policies, often departments of education may work with legislatures who were in charge of passing those policies to say, what was your intention with this? And then try to implement that. But you can see that things kind of get lost in translation and change over time. So for example, in the state of Georgia, we have just funding. And so our Department of Education is in charge of implementing and allocating that funding based on how they see fit. They've developed a set of products that are allowed to be purchased with that funding, but there's no specific oversight from the state other than the Department of Education on how that's being done and if it's doing what it should be. And so, at least in Georgia, that's what I work with them on to try to implement evidence-based practices. But yeah, it's not great.
Thank you so much. With that, you're officially free to go. I also wanted to plug in our lovely podcast, which is called the Big Decolonization Dialogue. If you like conversations around this, I think you may like some of those conversations. Thank you.
You mentioned
Yes, so we're working with Seattle utilities. They've done actually a RV scout program where they help the program is really cool, and basically our goal was to be able to offer that program so understand what's experience.
I work mostly as an organization, exactly domestic services that and then we show what kind of elements Southern California, they bring all sorts of things to it. And this was, I said, well, let's sit down and talk about it. What are the things that because of geology, you could do don't forget about those kids because really suffered. A big Southern California is a larger what percentage of free not only There is a data
They're